Hello, this is Daniel Wolfson with the ABIM Foundation, and I'm joined by Kate Kohn Parrott from the Greater Detroit Area Health Council. And we're here to talk to Kate about the activities of Choosing Wisely and her grant that she received through us and through Robert Wood Johnson Foundation. Welcome, Kate.
Thank you, Daniel. I'm excited to be here.
Could you talk somewhat about your organization first and tell us how it got started and what functions it does in the community?
Absolutely. So the Greater Detroit Area Health Council, which is referred to as GDAHC, has been in business for over 70 years. We're actually, I think, starting our 72nd year now in 2016. We are a multi-stakeholder, cross-sector organization. We started out as an organization that did work with the health systems and the hospital systems around certificate of need. And that was, like I said, 72 years ago. Over time, we recognized the need to be a more central cross-sector organization, and we became a membership organization. And today we focus on healthy people, healthy economy. That is our vision statement. We are, as I said earlier, a membership organization, and we bring together those who get care, give care, and pay for care to improve the delivery of care system in the Southeast Michigan community.
Great. So how did you get interested in Choosing Wisely?
We've been long advocates of Choosing Wisely. Our membership is very heavy into the health systems as well as the provider organizations. And we also serve the needs of consumers and the community. So Choosing Wisely was really a natural fit for us. Number one, again, working with the provider community, with physicians and so forth. I think many of them are primary care providers. And so the whole thesis, the whole background of Choosing Wisely and looking to help providers understand what are the right times and places to deliver some certain types of care was a natural fit for us and for our membership community, as well as wanting to be able to help consumers be better advocates for their health. It was just a great fit for who we are and the services that we provide to the community.
So let's talk about the grant initiatives, and let's break it up into two. How are you increasing awareness and working with the public in the Greater Detroit area about Choosing Wisely and why less is sometimes better?
Sure. So we are working with, as I mentioned earlier, the consumers, the patients, if you will. We work through our employer base. One of our partners, who's a great partner on this particular grant, is the UAW Retiree Trust, Medical Trust. So that is an organization that was created back in 2007 through the labor contracts with the three autos, the domestic autos in the Detroit area and the UAW. And what happened under that contract is they outsourced or took off the books of the auto companies the retiree healthcare responsibilities and liabilities and created an independent trust that manages that liability. And so the trust is very interested in making sure that its members are spending the dollars wisely and getting the right kind of care. So we've partnered with them in terms of educating 800,000 retirees across the country about the kinds of questions they should ask when they are when the doctors and their providers guide them to certain types of procedures.
UAW has always had a long tradition of being very progressive in healthcare. So how about on the health delivery side? Who are your partners and what are their interventions that they're trying to put in place to appropriately reduce unnecessary care?
So our partners in the grant, and we have a number of partners. One of them is the Henry Ford Health System Physician Organization. Another one is Detroit Medical Center Physician Organization, as well as the Michigan State Medical Society and the Michigan Health and Hospital Association. So those are all great partners. We are focusing with those partners on antibiotics for viral infections. So particularly in bronchitis, we're focusing on lower back pain. And we're also focusing on vitamin D testing for whether an individual has enough vitamin D in their system or not. So those are the three focal areas. The lower back pain is certainly one that's of great interest, and it's certainly a great interest in this community, particularly because there are a lot of injuries in the auto plants as well as in the suppliers. So the automotive companies as well as the suppliers have a keen interest in making sure that in fact and indeed that we're not just sending people out to get expensive MRIs and CAT scans for minor back pain.
So what are some of the barriers that you face as an organization and the delivery systems challenges as well?
I would say some of the delivery system challenges happen to be that you have a patient who comes in and wants to demand a certain test. So I think that the delivery system, the providers have to say, you know, this just isn't the right test for you. Maybe you say, you know, my back hurts really bad, or I have a cold and I really need to have a prescription. And the provider knows that in fact it's a viral infection, and you know what happens? You take those antibiotics over time, and you know we have these superbugs that are really infecting people today now, and the antibiotics are becoming less and less effective. And so I think one of the challenges is that the providers have to actually be firm and help their patients realize that they don't need those medications in those situations. Also,
how about on the community side? What are the barriers on the community side as far as increasing awareness?
Some of the barriers are really just how do you get out to the public? How do you communicate with the public? How do you grab their interest? You know, we need to work through multiple channels. You've probably heard the saying that people need to hear something 7 times in 7 different ways before they internalize it. So I think that some of the barriers are getting that communication out and getting the messages through to people. And so you have to pull different levers to do that. So we have to work with the employers. We have to work with the providers. We have to work actually in the public sector. So we need to do a lot of PSA, public service announcements, and get the message out. So it's really the whole thing about the 7 messages, the 7 ways that people hear things.
Good. So what does success look like to you, Kate, at the end of 3 years? What would success look like?
Success looks like there are different measures for success. So one of them is we're looking to be able to say that there's a 20% reduction in the number of unnecessary prescriptions that are written for antibiotics for viral infections. So that is one that's very measurable. We are looking at, as well as some measurables around lower back pain and the amount of imaging, as well as vitamin D testing. We have measures on those, and so did you meet those measures? That's success. But I think success is bigger and broader than that. Success really is have providers internalized the choosing wisely messages, have patients internalize that. Do patients come to the doctor to a visit with their list of questions? We have 5 questions that we're asking patients to ask the provider. Do I need this test? And what is the value of the test? Those are some of the questions. I think at the end of 3 years, at the end of the grant period, if we can say, yes, providers have internalized the messaging and patients have internalized those questions. To me, that's bigger success than whether or not we've met the metrics that we've asked and pointed out. I think
agree.
having an educated patient and a provider who isn't challenged by being questioned, by having the patient ask questions, that to me is success.
Great. Well, thank you very much, Kate. We really appreciate you coming online today and talking to us and talking to a wider audience. To get more information about Choosing Wisely, go to www.choosingwisely.org and go to the resource page, and you'll see many resources, including our newsletter and including this interview. So thank you very much, and we'll see you soon, Kate.
Yeah, thank you, Daniel. This was great. I appreciate the opportunity.